far as down at the muscle, the bone, the structure of the bones. It's this area right in here, the lumbar region, which has a natural curve to it, and that curve is supported by the abdominal muscles. So what happens in low back pain is it's usually related to weak abdominal muscles because it's not supporting. And then when we sit, our postures aren't sitting well, so we're not sitting good high on the ischium bones that we're supposed to be sitting on, which are these bones down here. We're not sitting well on these bones. Instead we're slumping back so that we're kind of on a tripod, and that will push the back into a more outward position and weaken the stomach because the stomach just kind of lets go. It will follow the lines of least resistance. So low back pain is common, and it's not fun. If it goes on too long, you can have things with arthritic stuff going on. Sometimes there's bulging discs. There's a various number of things that can be a problem. And in my practice over the years, I've found that I have a pretty good success rate with alleviating low back pain using some of the craniosacral techniques and the slow unwinding of the muscle tissue. But of course, some of this is also going to be more successful if the person with the low back pain is going to do some work on their abdominals to strengthen them. And it's not sit-ups, it's crunches. If you go beyond the, when you're starting to crunch up, as soon as you lift up the low back off of the floor, you're moving into the area of the hip flexor muscles, which are going to be pulling your body up. So you're losing the abdominal stuff. So you don't have to lift very much to strengthen those abdominal group muscles. There's actually 3 layers of it, and it's good to have a little bit of a twist in part of that exercise so that you get all of the muscles, the ones that twist our body as well as the ones that bend us forward and upward and hold us in. So I'm just here working the muscle, checking that out, and using some thumb iron. Again, you don't go onto the vertebrae itself. You want to work on the side of the vertebrae. And because there's a lot of stress from the positional stuff going on with all of this, that there's a lot of tension that's usually found close into the vertebrae. So that will give you another idea. I also check the position, of course, of the sacrum and the occiput, as well as the spheno-basilar junction, because I think that is key to alignment. The atlas, which is the very top bone, is another very key point to having good alignment in your back. From what I understand, the atlas has a difficult time staying aligned if the spheno-basilar junction is not aligned, and vice versa. So everything works together. If you feel that your back you're having maybe chiropractic work or something, you may want to ask your chiropractor if he adjusts the atlas. Not all of them do, in my experience. And there are some modalities. There's a modality where they do just the atlas adjustment. Now, from what I understand, and I did have it done because I try a lot of things out, it was very nice. And I asked the guy that did it if he did anything on the spheno-basilar junction, and he told me no, he didn't. When he found out that I was a cranial person, he said that he thinks craniosacral work is excellent to do along with that particular therapy because of the spheno-basilar. He did a lot of work on the sphenoid bone in order to loosen it and relax it enough, the attachments, in order to get the atlas in place. So there's definitely a connection there. And of course, when that's aligned up at the neck, head, then the rest of the spine is going to follow suit and it will correct. And a lot of times that can correct itself. But again, with correcting itself, we also have to be mindful that we need to have not only strong muscles, but flexible, pliable muscles. I personally don't think heavy-duty bodybuilding is the best on the structure. I think some weight training is good, but I also will say that those are my opinions for myself, and each person is different. The only thing that I really ask people to do is learn what their things are about, learn what it's about, and follow your own intuition as to what your body needs. Connect back with your body. Help it to find its way back to where it needs to. It's certainly conscious enough that it can do that. We've gotten very, very disconnected to our bodies and to our body's pain, and we almost fear it so much that we just will eat pain medication even though it doesn't help, in order to stay detached from what's going on. So I urge all of you to, develop that relationship with your body again. Learn about it. It has a wealth of things that it can teach you. So I'm just, for the low back, working down into these muscles that are attaching into the hip, working up into the vertebrae so that the muscles can be nice and soft, along with giving the stretch in the sacrum and feeling how the spine is, the muscles of the spine of this complete erector spinae muscle is soft, going all the way up. And then I would recommend to this client to do some sort of crunches and stretches for the back. So with